you have a headache? Would you like to try to fix it on your own? If so, this video is going to be good for you. Hi, I'm Dr. Putney from Wellington Family Chiropractic, and today I'm going to walk you through an assessment and treatment for cervicogenic headaches. So if we're talking about cervicogenic headaches, I know that's a big word, but essentially what that means is that your headache is caused by problems in the joints, the first few joints in your neck. Now that may sound foreign or uncommon, but it's actually something we see and treat every day. And so when people come in with these in the office, we obviously adjust them. If they need adjusted up there, we do a lot of manual therapy on the muscles, and we get great results with these type of headaches. But what I want to share with you today is what you can try at home. Because when these headaches come on, you can't always run in and get treated. So if you have a cervicogenic headache, typically they're going to start at the base of the head, but they can refer all the way around by the time they're done. So it doesn't have to just be pain at the base of your head, but a lot of times that's where it starts. It can be on one side, it can be on both sides, but these can be pretty severe. They can be very bothersome. A lot of times they get worse with sustained postures or moving your head or neck, and they can be tough to battle. So if you get one, here's what you can do on your own to try to assess and see if it's coming from those first few joints, and then maybe even fix it and prevent them from coming back. So what you'll start to do is a series of movements, and I'll walk you through them and see how that affects your headache. So what we're looking for is, does your headache intensity decrease? Or if you have pain throughout the head and face, does that pain come back and just kind of settle here or go away completely? Okay, so the first movement is going to be what's called retraction. So that means you're going to retract your chin straight back. So if I turn to the side, you'll see I'm not tilting or flexing my head first. I'm just retracting straight back. I'm going to go as far as I can. I'm going to use this web of my hand here, and I'm going to push my chin further back. And we're retracting 5 or 6 times, and on the last rep, we're going to hold that. And you can hold that for up to 3 minutes and see what that does to your headache. If your headache improves, you want to continue to do those chin retractions every 2 to 3 hours throughout the day until your headache's gone. And then you may be somebody that wants to do that on a daily basis, those chin retractions, for sustained periods of time to prevent your headaches from coming back. The next range of motion or movement you can try is called cervical flexion, and that just means we're going to tilt our head down. So for this one, your chin's going to go down to your chest, and you're again going to apply some overpressure with your hands. I'm not yanking on my head or doing it quickly. I'm going to the very end of my range of motion and getting a pull, 2 to 3 seconds, coming right back to neutral. Doing it again 5 or 6 times. On the last rep, we're going to hold up to 3 minutes. Again, you want to pay attention to headache intensity. Did it decrease? Did it move back to where it's just in a small area right here? If so, that's the movement for you, and you can do that every 2 to 3 hours to manage your headache. Now, if those 2 movements didn't work, you can try rotation. So rotation is going to look like this. You're just going to turn your head, pushing with your head here or your hand here, and pulling with your hand back here. We are not cranking the neck. This is not Steven Seagal movie. This is just a turning of the head to your very end range. 2 to 3 seconds, you come back. Do it 5 or 6 times. Hold and see if your headache gets better. You can try it to the other side if that side doesn't work. Now, this isn't the full assessment that we do, but these 3 movements usually improve a lot of people's headaches. So that's why I gave them to you today. So if you're somebody that's having some nagging headaches, they're frequent, they start at the base of the head and they work their way around, try this out, because one of these 3 movements may just help you prevent your headache or get rid of your headaches, but prevent them from coming back. So hopefully this helps you guys out, and I'll talk to you soon.